Hello, my name is Christian, and today I want to talk about something you may not hear about a lot, a little known eating disorder called pica. You may have heard of anorexia or bulimia, but pica is different, and it is often misunderstood. So, what is pica? At its simplest form, pica is when someone persistently eats non food items such as things like dirt, clay, paper, hair, soap, ice, paint chips, or metal objects for at least a month, even though those items aren't meant to be eaten. This isn't about a weird craving now and then, it's a pattern of behavior that lasts and often causes real problems. Pica is considered a feeding/eating disorder, but it doesn't look like eating disorders that many of us think of. Pica becomes especially concerning when the behavior goes beyond what is normal for a child, or when it continues in older kids or adults who don't have any developmental reason, or when it leads to health or social risks. Pica can occur at any age, but is often common in some specific groups: children, pregnant women, or individuals with developmental or intellectual disabilities. That doesn't mean pica is limited to those groups. It can show up in teens and adults also. So what does pica look like? If someone regularly eats non-food items, continues doing so for at least a month, and still does it even though it's dangerous or weird, and especially if there's no cultural developmental reason for it, then it's often a red flag and could be pica. Health risks can be serious. Things like lead poisoning if someone eats paint chips, intestinal blockages, dental damage, nutritional problems, or even parasites if soil or dirt is ingested. It's hard to say how many people pica affects, but studies and medical sources estimate that among children, the estimate is around 10 to 30%. Among pregnant women, roughly 8 to 14%. And among people with intellectual or developmental disabilities, it could be 20% or more. Pica is much less common in the general adult population. There is no single cause for pica. It is often a mix of factors: nutritional deficiencies, developmental or cognitive factors, stress, neglect, or traumatic experiences, or cultural and environmental backgrounds. The good news is there is treatment options for pica. What works depends on the situation. Medical and nutritional checkups are often first. Behavioral interventions utilizing techniques such as applied behavioral analysis, ABA, which rewards safe, appropriate eating habits, redirecting from harmful behavior, removing dangerous items from the environment. Therapy, for those whose pica seems linked to stress or compulsive behavior, cognitive behavioral therapy, CBT, or habit reversing training can help. Support and monitoring, especially if someone's pica relates to emotional trauma, stress, or neglect. Because pica often occurs quietly without social support, it can go undiagnosed or ignored. The term pica comes from the Latin word for the European magpie called pica pica, a bird known for its tendency to eat a wide variety of unusual objects. In conclusion, pica is a complex, often misunderstood eating disorder involving unusual cravings and risky behaviors. If you suspect someone, maybe a child, a friend, or a family member, who may be eating non-food items regularly, especially over the course of weeks or months, it's worth encouraging them to seek medical evaluation and professional help. Thank you for watching, and take care of yourselves both inside and out.